Hey, good evening. Hi, I'm Crystal, and I'm from Connecticut Family Support Network. I'm a family support director and a family care coordinator for the North Central and South Central region of Connecticut for CTFSN today. CTFSN. We're so lucky to have Janell Tartaglia here from Crescent Moon Physical Therapy to talk to us about the care for the caregiver, how to keep our physical selves healthy while we take care of our children. Hi there, Janell.
Hi. So my name is Janell Tartaglia. I'm a physical therapist, and I am the owner and primary therapist at Crescent Moon Care. The clinic is located in Canton, Connecticut. I am a pediatric specialist, but when I opened the clinic and I started working more and more with families, my passion for treating the families that I work with entirely, including parents and the caregivers, became a big passion of mine. So I'm really excited to give this presentation to share some different lifting and transfer techniques, and then just some of my favorite stretches and go-to exercises to help your bodies feel great. If you have any questions, please unmute and send them my way or pop them in the chat. That's perfectly fine too. Chris, do you want me to just keep going, right?
Please go right ahead. Okay. Yep.
So just quick objectives for today, like I said, we're going to just briefly review lifting and transfer techniques, review some body mechanics, review some stretches and exercises to ease frequent aches and pains, and then we'll have some time for question and answers at the end. Just a little disclaimer, this presentation is not intended to cure, diagnose, or treat any medical condition. And then if you're experiencing any injuries, please seek an evaluation from a doctor or a physical therapist to address your specific needs and concerns. So jumping right into it, what are the first things we think about when we're looking to do a transfer or move a child or an adult with physical needs is most people just kind of go right in and lift up the child or lift up the person and get them to where they got to go. We tend to do this in a hurry. We tend to just think about point A and point B. And one of the things I want to stress and kind of start off with is discussing preparing the environment. So that's looking and making sure that you have, one, all of the equipment that you need. So if you're transferring somebody from a wheelchair into a gait trainer, having that gait trainer there ready to go, brakes on, everything ready. If you're positioning into the bed, having the bed all set up and ready to go, or the bathtub, any of that stuff, just make sure that it's all there and all the equipment is ready. It sounds really straightforward, but often in the hustle and bustle of a day, it's something that we tend to forget, and we have a child or a person in our arms and then like, oh man, I forgot something, and we have to start all over, or you're walking a little bit further than you need to go with that child or person in your hands. The second thing is to position the equipment. So just having it nearby isn't always ready. And as a PT, this is something I tend to be victim of having the gait trainer there, but not having all the straps unlocked and ready to get the child into it. Making sure that the brakes are locked, because as those children get heavier and we need to transfer them into it, having that extra support of having the brakes locked is important for your safety and for the person being moved safety. Footwear, as this doesn't necessarily pertain to our young kids who aren't quite tall enough. As we go into some of the transfers, you'll see some of the positions that we get into. But if your child or if the adult that you're transferring is tall enough that if you go to stand them, their feet touch the floor, you want them to have shoes on their feet. This is really important because it gives them extra tread. This is something even going in and out of the bathtub, thinking about even if it's just having an anti-slip mat there on the floor, but having shoes or something supportive underneath their feet to give a little bit of tread is important as you see some of these transfers that we're going to be doing. Like I said, double check to make sure everything you need is nearby. If you have the option to have a second set of hands, use them. Multiple hands make for light work. That's a saying that I always know. So if you have that option or need to just wait a couple minutes, definitely take that time and get the second set of hands. This is really important, especially I find with children, is talking to the person who's going to be transferred and make sure that they're ready. Depending on a person's cognition or ability to understand what's going on, a transfer can be really scary. It can kick in a lot of tone for those people sometimes. They can shoot into extensor or flop over, and just having this open communication about what's about to happen to their body, letting them know that what directions they're going to be going. And for me, this is a lot of giving that person a say in what's happening to their body. A lot of our children and adults who are more dependent, who rely on somebody to move them throughout the day, they don't really have a say in what we're doing to them. So I like to give them this sense of ability to understand what's about to happen, as much as they can and as much to their ability, have them participate with you with these transfers, and that helps make it more successful. And then finally, for preparing the environment, is maximizing their ability to help you during the transfer. So just because a person doesn't walk, or just because, if it's somebody with an amputee, giving them the opportunity to help you as much as possible is incredibly important. Not only one, to save you, but also to start giving them more independence in this transfer, and giving them that fulfillment of being able to help you is really important as we go along. So that's just basics of kind of preparing the environment and setting up for, and I keep saying transfer, but it's really any sort of moving or lifting people around. So I tended not to leave a lot of words on the slides because I feel like visuals are more important. I apologize, I have to do this in my house today, and I'm not at the clinic to really be able to demonstrate a ton. So I hope the pictures suffice, and if not, just let me know and we can figure something else out. So I wanted to start with bed mobility, because this is one that's just very quick to just lift somebody up out of bed and put them in the chair, wheel them to where we have to go, and get going with our day. And this is a very compromising position for us as caregivers, in terms of potentially hurting your back, hurting your knees, hurting your shoulders. So when we're looking at bed mobility, if you look here on the picture on the left, you see the woman, she has one knee on the bed. She's as close as possible to the person that she's moving, and she's rolling them close to her. So she's not reaching all the way over the bed. She's not yanking a limb. She's really trying to be as close to the person as possible and rolling them gently over towards her on the side. Another option for larger children or larger adults is having some sort of like chuck or pad underneath them and using that to pull them closer. But when we're starting to think about lifting and moving, probably the biggest takeaway is to keep them as close as possible to you, to not let them get to this point that you're reaching really far out and pulling to you. That's when we're going to start getting injuries in our body. So this lady's kind of showing just, she's rolling an adult over from her back to the side. She's crossing over one leg on top, and that helps get over there. If you're playing with tone and things like that, going nice and slow. If you have a child or a person in your life who has a lot of tone and becomes very rigid and it seems like they're fighting you, slowing the movements down will help those transfers, versus a quick roll over tends to be a little bit more helpful. And again, talking to them about what's happening. And so I'm moving into my brain of the next step here. So when you do bed mobility, kind of just quick thing, if you're getting them all the way to the edge, you definitely want to make sure that wherever you're going to, so if it's the chair or a different piece of equipment, is right next to the bed, so that you don't have to then walk away with your child there at the edge of the bed, or your whoever you're caring for at the edge of the bed there. So yeah, if there's any questions coming up, please let me know. You can also play with too, a lot of kids' beds are shorter. So if you know that you are going to be the primary caregiver in terms of lifting and transferring, you may want to consider adding bed raisers to it so that you're not bent over so much into a low bed, and consider getting a higher bed so that you're not bending over as much. Obviously, if the child is getting in and out of the bed, that's a little bit different, because you don't want them to fall out and having rails on the side. Yep, go ahead.
Yeah, because my son has we just have a mattress on the floor. So
Yep.
Because he rolls out of bed.
Okay.
Out of the bed. So I guess like for me, there's a lot of right from the floor up, trying to get him up.
Yep, that's a big transfer for you guys. That's just a lift off the floor.
Yeah.
If possible, and obviously it's something I care about the safety of your child first, of considering having the higher bed with a rail on it, and just start kind of exploring your options for that, because as your son, you said right earlier?
Yep.
As your son gets bigger, you're definitely not going to be wanting to lift a full adult off of the ground.
Right.
But safety is a huge key here. So they do make special needs rails and things like that can be put on the side of it, not necessarily a hospital bed, but adaptions that can go on the side so that you don't have to worry about rolling out, but then you can also for him out a little bit better.
Okay.
Any other questions on this? Nope. Okay. All right. So the stand pivot transfer. Now, like I had said before, this is going to be a relevant transfer for our children and adults who are probably really age 5 and up, depending on the height and the size of that child. And what this transfer's purpose is to take some pressure off of you, so you're not doing that dependent scoop lift, where you're just kind of picking the child up and putting him in. I am not recommending this for every single person, but if you feel like it's something relevant to try, I would absolutely recommend it. So in this position, you can see the caregiver here in the blue shorts and we'll go with red shirt here. They've already gone through the process of rolling the person to the bed, to the edge of the bed, and have them sitting up there at the side. Now, a lot of the people that we care for, sitting at the edge of the bed is very hard for them, whether it be shooting out or falling over or losing balance. So often it's just a practice of bed mobility all the way up into sitting and then popping them over into the chair. It's not a lot of time left in that sitting at the edge of the bed position. So in this position, what he's doing is, and again, I'm not at the clinic, but you get a little tour of my sunroom here, is he's coming up right around that person who's sitting there with his legs wrapped around his knees and his hands kind of scooped up underneath. And again, he's very, very close to him. And what he's doing is he's just standing up. So it's essentially just standing and kind of doing a bear hug with this person, or I'll say his child in this case. And then what he's doing is he's just pivoting around and then sitting back down in the wheelchair. It's a very simple, that's why we call it the stand pivot transfer, because you're essentially just standing up with the child or with the adult, holding on to them very tight from underneath the arms. You don't want to be holding up from the arms. You want to kind of bear hug them, like a really big hug. And this allows that child or person to put the weight through their feet, which takes a lot of the weight off of you. So they're putting in their weight through their feet, kind of bear hug. You kind of do a little dance with them, pivot around, sit down into the chair that's right there. It takes a little practice. I would recommend having a second person with you, or if you're working with a therapist right now, having you guys practice this skill together. But it's a really nice way to, one, get weight through their feet, through the child or patient's feet, give them some weight and take some of that pressure off of you. But by you keeping them super duper close, you're not risking leaning forward or falling backwards. And again, it's not just this dependent pickup anymore. You're not just doing this deadlift of weight and popping over. Did that make sense with this? Does that visual kind of help there too?
Janelle, does that work for adults too, or is it just for children?
Nope, absolutely. Yep. And this is something that if I would not recommend this with adults, if the person is a completely dependent transfer, meaning they are not able to help in the slightest bit at all. If they have no muscle tone, things like that, a person who has like really good strength, or not strength, really good tone, and they kind of go into that straight posture, this is a nice one for them because they're going to kick into that extension and hold it there for you. But yeah, you could absolutely do this with adults.
The left one I'm thinking of has a lot of, she's actually on the other side, a very high tone. Yep. And it's interesting because even though she's a small person, she feels a lot heavier than she is. Yep. So
tone is tough.
Yeah. So I want to be able to visit and take her outside a little bit more, but I do not have a lot of strength in my upper body. So would this work for me, do you think, or?
Yeah, I think the one thing that I think it would be something that's available to you. Again,
Okay.
starting in that sitting position and just getting up to the standing is kind of the first step. If you're in
Okay.
that position and you don't feel secure, sit them right back down on the bed, and that's
Okay.
enough. Don't continue if you feel like, if you're not in a safe place. But once you're here, it's really kind of like you're slow dancing with somebody. So if you have a nice big bear hug on them, you're relatively safe to get there. Again, make sure whatever chair device you're going into is locked. This would be from like a bed to a wheelchair, or a wheelchair to another wheelchair, not into another piece of equipment. The thing with tone are people who have a lot of that extensor tone, like we're describing, is you have to go slow, because if you move really fast, it's going to kick it up even more. And then the sitting back down, you might have to sit and wait for a second for that tone to release. So the actual sitting back into the chair can be a little bit trickier.
Okay.
But again, if you're able to just kind of sit there and like help her release, I'm saying her because I think that's what you said, release into the chair, then it definitely could be doable. Any other questions on the stand pivot transfer? Perfect. All right, so the 2-person transfer. Now this is an option. I personally prefer to do this transfer with the knees bent and not the knees straight, but I don't know this patient's condition to say why her legs are straight. So the 2-person transfer is genuinely a go-to if you have the availability to do it. It just saves you over time of having to do as many transfers as normal caretakers have to do. So in this position, we can imagine that this person is moving from a wheelchair. It doesn't show the end destination. I'm assuming she's not just flying in the sky, but we can assume that she's going to go into a bed or into some other device. So in this position, the person that's in charge, so that's important in a 2-person lift, is that one person is kind of in charge of counting it out while the second is following the lead with it. So the person who's in charge comes around from behind. Again, we're looping up underneath the shoulders here. And as you can see, I don't know if you can see the way his hands are placed, but he actually crosses, if I'm the child's arms here. And as he comes underneath, he grabs from up top, which really locks in and gives you this nice safe. Again, it's that bear hug position. So in this lift, we're not just like hoisting up and lifting. We're really trying to keep the person as close to you as possible. So it's just like picking up a bag of sand or picking up a bag of mulch for your garden. It's something that's very, very close to you. The second person, she's demonstrating wonderful body mechanics here down on her knee. I tend to keep the knees bent down there, but again, it depends on the person. It depends on the tone or any other issues that may be going on, but they're supporting the lower body. So in this transfer, the person in the back kind of counts it out. 1, 2, 3, lift, and then everybody lifts straight up. And then you can kind of pop over here and you're in this nice position to float around. But as you can see in both of these, I'm looking primarily at the man lifting in the back. He's really not moving that much. It's just this small squat in this standing position. He has her supported here at the arms and underneath. So he's not tempted at all to kind of reach out and lean that way, which really helps support your bodies when you're lifting. These transfers are ideal, again, from like wheelchair to bed, bed to wheelchair, in and out of a tub, bench, or a shower chair, things like that. The stand pivot transfer, I would just be careful. That's the one that I recommend with shoes on. Kind of circling back to that one I would not try first time in a shower or when feet are wet. And if that is the case that you're going to be using that transfer, slip sneakers back on. They don't have to have socks and AFOs and the whole jam on, but just something to have grip underneath their feet in that transfer is helpful. But this is a nice option for a 2-person transfer. I don't know if anyone has any questions on that. Keep going forward.
I do again, sorry.
Yeah, no, go for it.
What if the person cannot bend their legs? So like when you put them into the wheelchair and the legs are so tight that it's difficult to get them to go down. Are there suggestions on how to help with that?
Yep. So with tone, a lot of it is just kind of waiting it out and just letting it settle, pulling their hips back as far in the chair as possible. So a lot of times we'll see out like this with their legs out. tucking their hips back in helps break up the hamstring a little bit, and that sometimes will allow it to come down. Manually, I'll very gently kind of put behind the knee, just some pressure on the hamstrings there, and very, very gently push down. And that tone will slow down there, but it's one of those, once tone has engaged, it has to kind of run its cycle a little bit. So letting it settle down, nice, slow, gentle pressure to it, and it will come back. So transferring into a stander, I just wanted to cover some of like the equipment that I know a lot of the kids that I work with have. So this is a very fancy stander. There's many different types of standers. This one is supported in the front. So I recommend, when possible, wheeling the chair up as close to the back of the stander as possible, locking all of the brakes, and then essentially doing that stand lift straight into the stander this way. I understand a lot of standers are supporting in the back, and that's more of the lift technique that we saw before. And so either doing a stand pivot there or doing the actual 2-person lift with that as well. I do not have a 1-person lift transfer on here because it's essentially a lift with it, but I do know that that's an important one to kind of discuss. So with a 1-person lift, I'm just going to cycle back. If we imagine kind of coming here from the side and scooping up, and so essentially coming right underneath that knee, right underneath the side there, so the child is sitting there on your side, and keeping them as close as possible as you kind of do a deep squat is the best way. I'm going to show a couple things in terms of posture that I want to address to help with the actual lift of that, because there isn't necessarily a magic trick for just a dependent 1-person transfer lift with it. It's more of your body mechanics that we'll go into. So that's into a stander there, one of those prone ones, just scooting it right up close. The gait trainer as well, these people are very fortunate. They have 2 people with them. I never had 2 people with me when I was doing them in the schools. In most families, it's normally 1 parent there. So again, pulling that gait trainer up, circling it right around the wheelchair as close as possible, or if you're transferring them from a bed, right there, having all of the straps and equipment set up ready to go. So once they're in it, you can just buckle in, is important with gait trainers as well. So just kind of a quick thing into body mechanics and lifting. These are things that we all know, but none of us do, including myself. So up here on the top, we see all of the things that we know will hurt our back. We're looking at these pictures and we're like, yep, that's going to hurt our back. Of course, this would be easier, right? But this isn't what it looks like when we do it. So my biggest thing that sticks with me when I'm doing lifts is genuinely keep the object or the person as close to me as possible. So whether that's positioning to me or moving them and taking that extra 5 seconds and just getting them into a better position, getting them as close to me as possible, I know is going to keep me as safe as possible. So the further we are reaching, the further we're scooping all the way out here, trying to lift up from here, and we're doing these compensating movements, the more we're putting strain on our back. I would love if we could all get down in this deep squat when we're lowering down. It doesn't have to be that low, but really being mindful of going down with our knees with it and not just kind of plopping over. And that's every time we're lifting, not just when we're lifting heavy humans, when we're lifting groceries. Christina, when you're doing the transfer from the floor to starting in like a half kneel position, so 1 knee down and 1 knee up, so that you are kind of set up that way, is a really good thing.
Yeah, because sometimes I feel like when I'm lifting, I try to just do at the bottom and do both like knees, and then I feel myself getting from like the floor to the couch and then the couch to me.
Yeah.
To bring him like upstairs.
Yeah, it's
so
a lot.
Like a 2-step. Yeah.
Yeah. So I would say like from that floor transfer, not doing that deep squat, because you're going to lose your balance. That's way too low. So that half kneel, so 1 knee down on the ground, getting him as close to you as possible and almost like scooping him up. So like you're kind of holding him, and then if you can push up from there, obviously try to do it maybe without him. I'm not sure of physical limitations in terms of coming up from a half kneel, but coming up from that position, or and that's going to give you more stability than that deep squat. You're going to have no sense of balance if you're as low as this lady is when you're trying to pick up your child. So that half kneel is a nice position from that low position. Also, if you're able to, in that half kneel, even getting him up, I'm not sure if he has other equipment at home that's even just kind of breaks the middle from the floor to a wheelchair, of just like into the chair, and then you reposition yourself and then into the another chair, just to, so it's not this full lift from the floor, but in the meantime of trying to figure out a way to make that not as low for you guys in the future, which is a hard thing. So there's a lot of variables in that, but that's the essentials with lifting. Really, as much as you can, be mindful of keeping the person as close to you as possible. Really, lots of deep bear hugs is like my go-to. Always like snuggling with like even legs wrapped around me like a koala bear, because that's how I know it's essentially just like I just gained 50 pounds and I'm just holding it right here. Because as soon as that comes out off of your body, all of that torque is going onto your low back and your upper back and everything else. And that's when injuries happen very, very quickly. So any questions on this? Nope. Okay. So another thing, I mean, we think about lifting a lot, but things we also need to think about are pushing and pulling. If we're working with people who need to be transfers, majority of the time they're in some sort of wheelchair or assistive device. So being mindful of your body position as you're pushing and pulling is also really important to help your body. So pushing, you see how this guy has gotten into like a little bit deeper squat. I imagine this is like pushing up a hill. We kind of squat down there, keep down low, try to keep as many bags off of it as possible if you're going through like gravelly or up hills, and then pulling again, kind of squatting down a little bit and really being mindful to keep it close to you. The nice thing about most manual wheelchairs is they're relatively easy to push. Power wheelchairs, when they run out of batteries, those cause a little bit more of a trouble, and those are a little bit heavier to manage. But it's just another thing to kind of be mindful of as you're doing it, because as much as lifting and transferring can cause injuries, pushing and pulling and maneuvering large pieces of equipment can also as well. Especially even once the child is transferred into a car and then getting that chair into a vehicle is a whole nother time to think about keeping things close to you, breaking the chair apart if you're able to, taking some of the weight off of it before you hoist it up, if that's a situation that you guys need to be in with equipment. So we're going to go into some of the other stuff in terms of like making your body feel better and stronger, but to kind of wrap up the transfers and liftings and things like that, some key takeaways. First up, remember setting up the environment for success. So having everything nearby, making sure there's nothing around you that you're going to trip over. Guilty as charged. I'm always tripping over things. Making sure the person who's going to be moving is ready and helps you and participates to the level that they're able to. So if they have that extensor tone, use it for that stand pivot transfer. Give it a try, even just practicing standing up at the edge of the bag and doing bear hugs, and then sitting back down, and then standing back up, or from the couch. It doesn't have to be the bed. Standing back up from the couch and then back down, and just practicing and putting the weight in their feet. You getting a good feeling for this. You can practice doing some like little dancing back and forth just to work on some of that, kind of preparing for the stand pivot transfer if that's not something that you are used to doing. Keep the person or object you're moving close to your body. Bend your knees or go into that half kneel position if you do need to go onto the floor. Pivot your feet. Don't use your back and arch or twist. Take your time. Definitely don't rush. If you're starting a transfer and it doesn't feel right, put them back down, because the last thing you want to do is be compromising your position and their position halfway through the transfer so that nobody gets hurt. And that's my final point. I'm glad I read my mind, is don't be afraid to stop and start over if you're not feeling safe. Or if all of a sudden you stand up and the tone like super duper kicks in and you're like, this is not okay, put them right back down in the safe place and start all over again. So any questions on that before I go into my next part? Sorry, I just needed a little bit of water.
Does body body size or anything like that of you as the lifter, are there adaptations that you would need to make? Or like, I'll even give you an example. Again, I have a larger bodied person and I have already some back issues in general. So would this fit everybody, or is it?
No, we don't become the Hulk. I am 5'2". I am not, I'm not managing giant people. That's where the 2-person transfer really comes into play. There are things like gait belts and things like that you can put around the person to give you an extra hand. It does not help in terms of the actual lifting. It's just a handle to hold on to. If you feel like sometimes pajamas are slippery or clothing gets in the way, a gait belt is a nice option to put around a person. If they have G-tubes or lines, just be mindful of that because those get in the way. My best advice would be is if you feel like it's somebody that you're already transferring and moving and you want to try some of these different ways, is just try like the stand up one and see how you feel with just standing up and then sitting back down and practicing it. But and a lot of these do take some practice for you and for the person that's being moved. If it's an older adult that has been transferred a specific way their entire life, they have to learn how to be transferred a different way. There are mechanical lifts. I didn't go into that in here in terms like a Hoyer lift or the track lifts and things like that are very expensive. But it is something that is available for larger people who need to be transferred as well. But those cause their own kind of headache in terms of setup and honestly, we are supposed to recommend that 2 people do those as well. So no, I wish there was a magical Hulk button though, that I could just be like, I could do it. I try really hard sometimes, but it doesn't work out. All right. So, there we go. I'm just checking my time. All right. So some of the key points I wanted to go over to help your body. I'm going to teach you guys about the magic in your belly button. It's my favorite thing to talk about. If you've ever been in my clinic, I guarantee you've heard it. Talking about keeping your neck relaxed and then just a couple ways to just stretch and strengthen. And again, just follow your doctor's advice. If they've told you not to do things, don't do them. But these are definitely things to consider as you're able to do them. So I talk about the magic in your belly button, and the reason is there's a muscle inside your abdominal wall called your transverse abdominis. It is your lowest layer of abdominal muscles. It's this guy here. As you can see, it starts underneath your ribs and it wraps all the way around your body, all the way to your low back. This is the only abdominal muscle that acts full circle. It acts as our inner girdle muscle. It's the one that kind of pulls us up and in and gives us flat stomachs. It is weak on everyone, myself included, men, women, children, everyone. We don't use this muscle. The muscles we tend to focus on are those 6-pack muscles. So that rectus abdominis muscle on the outside, and that muscle just comes here on the front. So the reason I get very picky about this muscle, and I'm going to now refer to it as your belly button, is because this is the muscle that when we ask it to engage, this is the one that's going to be helping to support your low back. So if we just go to lift and just pick up and arch up this way, we're using all of our low back extensor muscles. Most of the time our belly is kind of poofing out in front of us to kind of brace out here. And this muscle is doing nothing. And with that, we're compromising using those tiny little back muscles that aren't strong enough to be lifting up 50, 100 pounds. We're putting pressure on our spine. We're doing things to our discs and things like that. So the magic in our belly button is a transverse abdominis, and don't you worry, I will teach you how to make it work. The thing with this is it takes practice. I swear if I could get people to get this muscle to fire, when I say fire, I mean activate the right way, and like the first time I see people, I would be a bajillionaire because it just would be wonderful. But the truth is it's not that easy. We often compensate so many other ways in our daily life. So in order to get this muscle to fire, you can do it right there sitting. There's no real restrictions for it, so I don't see any reasons why we can't do it. You don't have to lay down. So sitting here, I want you to take your fingers and you're going to put them right on the inside of your hip bones here. And you're just going to like right inside, like, I don't know. Yeah, your hip bones. So what I want you to do is, by not holding your breath, I want you to pull your belly button in towards your spine and then up towards your ribs. in a very, very small motion. Now don't hold your breath and then relax. So I have many people describe this to me as like an ice cream scoop, as if I was like scooping a scoop of ice cream out of you. Or like the letter J is another way. Now, if you felt like you got it on the first time, you didn't. What most likely happened was that outside muscle kicked in there. I actually want you to feel the muscle contracting underneath those fingers in there. So you're going to pull your belly button up and in. Women also kind of feel like they can do a Kegel when they're doing this as well. It's a very similar feeling. And then when you relax, you should feel your stomach kind of come out. Not kind of go into like a potato, but just it's a very small motion in. You should feel your belly button come in and then out. So you guys can keep practicing that all the rest of the time that I do this. So it seems really simple, but the thing about this is if we start asking and start thinking about pulling that belly button in, you should be able to breathe when you're doing this. You shouldn't be holding your breath, or else that's all diaphragm and you're not doing the right thing. You're actually just doing a Valsalva, which isn't good for you. Is if we start training this muscle to work just throughout your day, and just every time you're doing dishes, you just pull it in and hold it for 5 seconds and then relax. You're taking a shower, every time you wash your hair, you pull it in for 5 seconds and you relax. I tell people every time they're at a stoplight or a stop sign, pull it in and relax. The more we ask it to fire throughout the day, the stronger the muscle is going to get, which is going to help you when you're doing these lifting things. So my challenge to all of you is to, one, now start doing this a little bit more, is pulling that belly button up and in. Your pelvis and your hips shouldn't move when you're doing it. So a lot of people that have done yoga, when I have them do it on their back, they feel like doing this full, like this pelvic tilt backwards. It's not that. It really should just be your stomach muscles pulling down and back, with everything else staying still. I promise you, the more you practice it, one day it'll be like, oh, I just did it. And then it kind of kicks in and you can do it more and more. But my other challenge, besides doing it as often as possible, is when now every time you go to lift somebody or move somebody or push something or pick something up, is think about pulling your belly button in first and then lifting. And this is going to start strengthening that muscle and start giving you that stability and support in your back when you're doing these things, to avoid injury in the future. It was a very long-winded thing. I normally spend like half an hour on evaluations on that one topic, but I strongly recommend like kind of looking into this a little bit. If you have any questions, I'll give you guys my email at the end. You can email me and I'm happy to help there too. So another way that you can kind of feel this too is on your hands and knees, because gravity naturally pulls our stomach down, is keeping your back nice and flat and then just pulling your belly button up. And a lot of times people will then get the better feeling in that position versus sitting or laying down. So posture is another kind of hot topic too. So this is demonstrating all of our major posture muscles here on the left. And then on the right here, this is demonstrating what the majority of adults and now children that have had to go through distance learning all look like, is with that. Those tight muscles here up front are pec muscles, weak neck muscles here, tight muscles here in the back. That's the one that we all love to get like massaged at the end of the night, because we're just like rubbing ourselves here, because these muscles are spending so much time kind of keeping our head up, and weak muscles here in the back. And that all contributes to this. I call it the potato pose, is with us, where we sit like potatoes. So that's just kind of showing bad posture. And then some of the ways to work on it are, I'm giving you guys all of my favorite exercises. So if anyone ever needs PT and you come to me, don't expect anything magical besides this. This is what you get. No, I'm just kidding. But the shoulder blade squeeze is one of my favorite ones to start with, because most of the day we spend our shoulders forward here when we're doing lifting, we're helping people, we're sitting at the computer, our shoulders are forward. This is an exaggeration, but we all know our shoulders sit forward more. So in this position, you're going to keep your shoulders down and relaxed. And what I want you to do, the ladies in here can think about squeezing your shoulder blades down towards your bra strap, because I actually want it to be a really low shoulder blade squeeze. So you're going to squeeze the shoulder blades back and just hold for a second and relax. And then squeeze back and relax. So this is a nice thing to do doing 10 every hour, especially if you're heavy sitting on the computer. If you do a lot of lifting and things like that all day, these muscles up front get so tight and the muscles in the back get really, really weak. This is a nice way to just start kind of pulling everything back and strengthening. It's a really subtle motion. Nobody really has to know you're doing it. I like to do a lot of things in the car. So it's a nice thing to do when you're in the car as well. So the doorway stretch is a nice one. You can also do this in a corner, but I like the doorway. I do not have a doorway present here to be able to demonstrate with you. Christina, I would not do this one yet. And I showed you here a couple different positions that people do. Honestly, there's a fourth one with down low, but what you do is you go right into a doorway. I have a smaller frame, so putting two hands on a door is a lot for me. So I tend to do one arm at a time. And starting right in this guy here in his A position, your arm's just here. And what you're going to do is just lean forward a little bit. So what he's doing is he's leaning his weight. You can't see me point. He's leaning his weight here on that right leg. And he's just getting a really good stretch in the front of the shoulder here. I would stay away from this if you've ever had a shoulder replacement, if you're recovering from rotator cuff surgery, any of that. Obviously, wait for doctors, okays for that. But this stretches out this pec muscle here that gets so tight that pulls us constantly forward in this position. If you get those chronic headaches and those tension headaches, this is a really nice one to alleviate a lot of that pressure, because we don't realize how much this is pulling us, so that these muscles have to kind of kick in to kind of get there. So this is a nice one to alleviate that. So you can play with your arm position. So it can be here, but if that's uncomfortable, you slide it up higher. I personally tend to like, which is not pictured, having my arms down low like this and kind of like flying through like Titanic pose, but holding it there for 20 seconds. Again, a nice gentle stretch. Nothing should be painful with this. Really helps release the front of the shoulders and take some of the pressure off, excuse me, off of the neck and the shoulders. This paired with the shoulder blade squeeze is a really great one just to kind of work on overall posture and upper body positioning. Any questions on those? Nope, we just have a couple more. I know we're getting close to time. So hip flexor stretch is like a secret stretch. I think it's secret because most people spend time working on their quads, their hamstrings, their piriformis. If you watch people stretch, not that I'm not going to address those in these next ones, but the hip flexor stretch is an incredibly important one, especially if you're lifting all day and you're caretaking, because these muscles here, your hip flexors right here in the front of your pelvis, get incredibly tight and they kind of pull down, they arch our back, they push out our belly, it does all of these yucky things to us. So this girl is demonstrating, she has one leg down. I have not great balance, so I like to hold on to something when I do this. She has one knee down, one knee forward. She's up nice and tall, and then she's just very gently leaning forward onto this leg, and she'll get a stretch here on that right thigh. If you coincide this with pulling in your belly button, you'll get a deeper stretch, and it's just a really nice way to release. I know it stretches the front, but to release some of that low back pain if you have like kind of chronic hip flexor pain, if you're like in the car and you're kind of like digging into your hips, this is a nice one to release some of that too. I put a pillow underneath my knee because my knee's a little bit sensitive. I know not everyone can get down on their knee, so a way to modify is to grab a chair and my tiny little sunroof. You can put a leg on it like this, and again, just kind of shifting your hips forward this way, you're going to get a nice stretch in the front of your leg here. That's one of my go-tos. PTs cannot sit still. I don't know if you have many PTs doing presentations, but this is the stillest you're going to get.
The last one, Janelle, you were pulling yourself backwards in the modification that you did. Not forward.
I was shifting my hips forward. So all of them, you're going forward. Sorry. So in this, my leg is forward, and I'm just kind of like pushing hips forward. Yep. You can't really lunge with your leg up there, but it is a nice modification if you don't have the ability to get on the floor, or you're at work and you don't want to be a crazy person like me. So hamstring stretch, everyone knows a million ways to do it. My biggest thing with this is to actually do hamstring stretches. Hamstring stretches are not ideal. A lot of people do it for like 10, 15 seconds. They're like, nah, that was good. And I didn't like that. I like using a strap or a towel and really focusing on the knee being straight first. And then I wish this arrow was actually pointing more towards her face because you're really pulling the leg. Can you see my mouse? Okay. You're really pulling the leg up towards here. And again, whether your leg is here or all the way up to your nose, it doesn't matter. What matters is that you're getting a stretch here with your knee bent. It's nice because it takes some of the pressure off your back. But if you're spending time with your kids on the floor, might as well just grab a strap or a towel and just spend a couple times doing that. All the stretches I recommend doing at least 30 seconds. The longer, the better. The 30 seconds tends to be what people can kind of manage in their daily life. And doing 2 or 3 on each side. This is one of my favorite hamstring stretches, but really any way that you have found that feels good for you, just spend time and do that. A lot of that lifting and bending over these hamstrings get really, really tight and put a lot of pressure on your low back. We're almost there. The IT band stretch is another secret one, like the hip flexor stretch, that is commonly ignored. So your IT band is a band that runs on the outside of your hip. It starts here, it comes all the way down to your knee. So in this position, you set up very similar to how I had that hamstring one, except this guy's using a strap and not a towel. And then by keeping your hips actually on the floor, you're going to pull that leg across. So don't let your whole butt pop up and over. You see how he's just bringing the leg over, and you'll feel a very uncomfortable stretch on the outside of your leg. And that gives you a nice stretch out there. Did you have a question, Crystal?
Oh, I did. I was waiting for you to end. Sorry.
No, go for it.
Is that what's responsible for sciatica? Like, this would be the people who have sciatica would use?
It is something that they could use. So sciatica is actually, it's just nerve pain from the back. So that's stemmed from the low back, the actual nerve. But a lot of times the IT band being tight can kind of pull on the pelvis. And again, this is one that's very commonly missed in stretching, as we spend a lot of times on quads and hamstrings and piriformis, because those are like our biggest focus. And oftentimes when I evaluate them, I find that this is incredibly tight, and this causes a lot of that low back pressure. And yeah, I mean, this would feel good for somebody probably with sciatica, depending on their symptoms. It's hard to say. Everyone's a little bit different with it, of what they prefer, but as long as it's not painful. And that's kind of one of these things too. None of these should be causing any pain. So if you're doing it and it's hurting something, not just yucky stretch, but actually hurting something, stay away from it and kind of reassess what was going on. Maybe it was your technique, or maybe it wasn't the right stretch for you. But after stretching, you shouldn't hurt. So that's just something to kind of be mindful of. It should actually feel better, but the actual stretch itself isn't ideal for everyone, especially if you're tight.
And is that sciatica when you have that like pain shooting down your leg?
So yeah, so sciatica is like a catch-all term for nerve pain radiating down your leg. It's very commonly, like the nerve pain is very commonly associated with like a disc or something like that, but it can also be like in an older adult, arthritis and stuff like that. So yeah, it's kind of the layman's term for radiating pain down the leg, which is a nerve pain, but it's all stemming from the back. It is. So yep. So this is one of my favorite stretches. And so a lot of people will do just the figure 4 stretch. If you see this woman here on top, they put their leg like that, and then they pull the whole unit up towards their chest. And that's a really nice piriformis stretch, which again, a lot of people with sciatica or back pain will do. And I recommend that one, but I wanted to give some ones that aren't commonly on like Google searches of what to do for my low back pain. And so this is a nice way to kind of change it up. Again, I wouldn't do this if you have any like major hip injury, definitely not hip replacement, things like that. Kind of be mindful of any precautions that you've been told not to do. But by putting one foot on your knee, and I mean, you guys can do this in sitting too, is just a nice stretch to really open up the hips there. And you can do it by, let's see if I can make this work here. I'm kind of going my left here. So one foot on your knee, and you can play with just pushing gently downwards. And then you can also play with pulling it upwards like this and kind of giving yourself a bear hug in this position. And that's going to give you that nice stretch in your piriformis and along that IT band too. This lady takes it a step further, which needs to be done on the floor unless you have some ability to do this sitting in a chair, but starting that way and then allowing that foot to drop over, and it gives you a really nice deep stretch in the hip and then in the low back as well. So figure 4 lower trunk rotation. It's one of my favorite stretches to give for that like chronic achy, like deep pain in the butt and in the back. It's something I like to try out as well. So yeah, so that's kind of where I left it. Obviously I could give a million different ideas of exercises and stretches and things like that to do for people you have specific issues, but overall, those are my go-tos of strengthening and stretching in terms of lifting and body mechanics stuff. So anyone have any questions?
No, I mean, I think the stretching is the thing that I need to do more of, that I don't do. And like when you were showing that other one, it was like the lower trunk rotation. I was like, but then when you did it on the chair, I'm like, oh, I could probably do that at work.
Yeah.
And not have people like, wonder what I was doing. I could just do it there.
You could do it there. Absolutely. Hamstring stretching you can do in the chair too. I didn't put it on there because it's not like my go-to. Sorry about the visual. Is sitting in the chair, just kind of kick one leg forward here straight. And then you can just kind of lean forward a little bit and you're going to get a nice hamstring stretch there too. And then mix it up and stand up and put the leg on the chair and get the front of the leg stretch. You can get a lot of these done in sitting. They don't have to be laying on the floor. So wherever you can do it, do it. It's kind of the go-to of it. But I'm glad that you kind of figured out a way to make it work there. Do you have any questions about specific transfers or things like that? Kind of get some new ideas for things to try at home.
Yeah, I mean, I think it's more because sometimes I don't think when we're transferring. Like we have a like a massage table now in the living room. So that's not that's what we changed him on. He has PT at home, and they use that, but that's a good halfway mark. You know what I mean? To get him on from the chair to there and then onto the couch sometimes. But I think a lot of it is going up and down the stairs with him and getting him from the floor.
Yeah. And I would see when his PT is there with you, ask them and have them help you kind of brainstorm some ideas. Because when you're in person, it's so much easier for us to be like, oh, let's do this. They're there for you too. So as much as they're there to help him, helping you help him is going to be really important. So for that. So
Well, thank you so much.
Thank you.
Thank you for Janell that was awesome. And this is going to be put up on our YouTube page and spread around a little bit. So if you haven't checked that out, please go and do that when you get a chance. And I really appreciate you coming and sharing all this wonderful advice with us. And thank you, Christina, too, for Christina.
Yeah, thank you.
No problem. No, I saw this on the Facebook page, and I was like, because that's what I always, he is getting bigger and he's getting taller, and it's all like I'll sacrifice myself for him, but then I'm like, now my husband has to be the one to carry him a lot, and it's hurting his back too.
Yeah.
So
he's just going to get bigger. So start making changes now is the most important thing. That's what I always say when parents are lifting up a 4-year-old and they're like, oh, it's fine. I'm like, but he'll be 14 one day. He'll be 24 one day. They get bigger quick.
Right. Yeah. I mean, and we went to a abilities expo on Saturday, and I see those safe bed things, and but then I'm like, oh, it's not going to it's like that monstrosity of like a bed, but I'm like, maybe he does have to be a little bit higher up. Maybe not like at the safe bed where it's kind of like they're really, really contained.
Yeah.
But maybe he does have to be a little bit higher.
Yeah. I would think I would go higher for him
Yeah.
if you can. Find a safe way. It doesn't have to be the big intense bed, but just something to help you
Right.
guys. That's gonna get pretty big pretty soon. So,
Yep. Yep.
You're on the right track though. I'm glad you're starting to look into options and figure things out now because you're on the right
Yeah.
path. So, and you're doing a great job. So
Thank you.
So I did put my email up on top of my name. You probably see it next to my name if you have any questions. I don't know, Janelle, if you have anything you want to ask Janelle later on, you can always email me and I can get it to her. Or
yep, that's
Okay.
fine. My email is also crescentmooncare@gmail.com.